help reduce sleep deprivation, especially in this time, in this season.
Thank you, Dr. Abdullah, for the question, which is a great question and challenging question. I think we need to work in all sectors, starting from the community, by increase the awareness of the sleep deprivation at the level from the childhood, adulthood. Every age group should be know the effect of the sleep deprivation. Then we'll go to at the level of institute, work at the level of the schools, at the level of the healthcare institute. Then we look for the health policies and academic also policies to make investment, research and publication. Also in the governmental institute to make some policies that emphasize to how to deal with the sleep deprivation as one of the global epidemic disease.
Well, as we all know, the sleep deprivation is one of the dominoes effect that leads to the chronicity of the chronic diseases itself, and also for the severity of these diseases. And for such chronic disease, this will have a big impact in our life, in our lifestyle also, and it will have a chronic impact on the motor vehicle accident incidents. What's your comment about this, and what's your comment about the not only the motor vehicle incidents, and about the all other diseases that we can see and face? Especially, let me be selfish on this. In my surgical field, we see the ugly side of non-complying with your advice as a lifestyle and sleep medicine doctor.
Yes, great question. Important of sleep. Start the story researching about the important sleep by looking what is the effect if I'm not sleeping. As we saw, as we discussed only for a chronic disease, but actually each system and each organ of the body has been affected by sleep. There is a function has been linked to the system. Any effect in the sleep hours or sleep quantity that's been lead to the effect of this function, that's at the end of the disease. As we saw in the lecture, obesity, diabetes, hypertension. Nowadays, Alzheimer has been linked to the sleep deprivation. Neurological symptom. As one of the important things you mentioned, it is a road traffic accident, secondary to daytime sleepiness. It is one of the fatal cause of the road traffic accident that's happening secondary to sleepiness. Worldwide, around 20% of the road traffic accident secondary due to sleepiness, or we call it drowsy driving. Here in Saudi Arabia, we have around 5 papers published that show around 11 to 12% of road traffic accident is happening secondary to drowsy driving, either sleep deprivation, sleep apnea, or whatever called the sleep disorders has been affected.
Thank you so much, Dr. Mana. A question to Dr. Ayman about the 90-90-90 plan. I just want to know about the updates. Where did we reach on that plan till now?
Thank you so much. We still collecting the indicators in those plan and verification of the data and the quality check. So yeah, but the majority of the health care providers, the health clusters are on track.
Let's hope to see good results, inshallah, by the date that you already decided to show us the results. By the end of this session, I would like to say that lifestyle medicine is a multiverse of medicine. We have with multiple specialties, including sleep and preventive medicines, family medicine. All the spectrum of medical fields are sharing the lifestyle medicine and the journey of the patient. Thank you so much for our presenters, and I'll leave it for our collaborators here in the conference. Thank you so much, Dr. Mana. Thank you so much, Dr.
Now it's the moment of honoring and recognition of our moderator and speaker.
It's amazing how every culture has its own healing traditions, like fasting, herbal remedies, and movement rituals.
And today, we are seeing how these traditions align with modern lifestyle for chronic disease care.
Which tradition from our and your culture you think we should bring back?
Our next session moderator will wrap up the final session for today. Dr. Naif At-Tamimi, Master's degree in Clinical Pharmacy, Financial and Administrative Assistant at King Salman Specialist Hospital in Hail. Please welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to thank you, the scientific committee, to give me this chance to share him with the 4th Lifestyle Conference. And I will introduce final speaker, Dr. Abdurrahman Al-Dargawi from Algeria, from Aljazair, medical doctor assistant professor in epidemiology and preventive medicine consultant, International Board of Lifestyle Medicine Public Health Consultant. Welcome, Dr. Abdurrahman.
Bismillah, salatu wassalamu ala ashraf khalqillah. Thank you for giving me the opportunity to speak before you in this amazing event, the International حائل Conference for Lifestyle Medicine. I'm very proud to be here to discuss very important. But I am from Algeria, but I am working here in حائل Health Cluster as a working director of population health management. Thank you for this nice introduction. So welcome everyone. I said this topic is very close to my heart. We are speaking about diabetes remission, which affect more than 1 in 5 people, adult people in our beloved region. So for decades, we were telling our patients that they will have this disease for life. And the current evidence are changing that conversation. We have new things to say. So today, talk is not a technical talk, but it is a message of hope. It is not about managing decline, but rather enabling recovery. So let's deep dive. So the global burden, we have approximately 537 million of adults worldwide living with type 2 or diabetes. It's 1 in 10. And the projections are going high. We are expecting to have nearly 800 billion by 2045. So this is a huge number, and we are not doing so much. Let's bring this home. In Saudi Arabia, things are not really good. So we have the second highest diabetes prevalence in the Middle East. We have 7 million Saudi living with diabetes. 3 million more have pre-diabetes. So huge numbers. So the human and economic costs. So the health impact is huge. We have this leading cause of blindness, kidney failure that needs dialysis, amputation. It enhances the risk of cardiovascular disease by 2 or 3. The economic burden is about $1 trillion annually, and half of it is considered for the treating the complications. Let's zoom into our beloved region, Hail. We have approximately a prevalence of 80% of type 2 or diabetes, and this is a very optimistic number. This is a very optimistic number. I think that the numbers are more than that. So the current approach, why the current approach falls short? Because we are not addressing the root cause of the disease. We are treating the numbers. We are treating the glucose numbers. We are not treating the root cause. And with all the treatment, the new treatment that we have, we are not doing well. We have injections, we have pills, we have different things going on, but we are not reaching our target. So something needs to be done. So now I invite you to change our vision and to change our paradigm. A new paradigm is emerging, which is type 2 diabetes can be reversed. And it is true, and there is a lot of studies that can prove that. So remission, the new goal. We need to establish remission as an outcome, as a new goal for treating our patient. They need to know this. And as said Professor Roy Taylor, diabetes reversal should be the goal. And I think it's an ethical question. We need to discuss that with our patient. We need them to know that there is an issue to this disease. So this is what we call the twin cycle, vicious cycle hypothesis. The liver cycle, where the fat accumulation induces insulin resistance and excess glucose production, and the pancreatic cycle, where pancreatic fat induces beta cell dysfunction and reducing insulin secretion. But the good news is that we can reverse the two cycles. That's great news. The insulin resistance, this is the enemy. This is the root cause of the type 2 diabetes. So the glucose buildup in the bloodstream, we have a pancreas overwork to compensate these numbers, and high insulin drives weight gain. So this is a vicious cycle. And we add to that the inflammation. The inflammation increases by different mechanisms, the insulin resistance. The path to recovery. What is the path to recovery? So weight loss. If we lose even 10 to 15 kilograms, this is the catalyst of diabetes remission or diabetes reversal. So liver fat normalize very fast in a lot of cases. Fasting glucose drops very quick. Pancreatic fat shrinks, and beta cell will wake up, and insulin sensitivity returns. Blood sugar normalizes. So we can do something about this. So what is the definition of diabetes remission? So we need to know that diabetes remission is a clinical stage. Okay, it's clinical state. We can return back to type 2 diabetes, but is a clinical state. So HbA1c lower than 6.5 for at least 3 months without diabetes medication. And now we have a name to it. We have an ICD-10 classification. We change everything. So it is E11.A. Keep in mind this newborn, E11.A. We have a name, we have a classification, so it's real, it is here, and we can do it together. So to prove that, there is a lot of studies done, and one of them is landmark evidence direct studies in the UK, in different PHCs. So it's real, it's not a fancy hospital for clinical trials, it's real people working and going to the PHCs, and they had 46 remission rate at 1 year, which is really huge. Consider 64 or 46 remission at 1 year and 36 remission rate at 2 years. This is a huge thing. So we need to really consider that, and we can apply that here. Of course, there is the counterpoint study. We have the Virta Health study for keto diet, intermittent fasting in China, and all the studies show the same thing, that we can reverse this disease. Best candidate for remission. So this is a very important point that we need to discuss. What are, from our patient, the best candidate to undergo this remission? First, the shorter diabetes duration, ideally inferior to 6 years. Overweight, obese, BMI superior or equal to 27, because they can lose weight, and not yet on insulin or lower doses. There is some insulin beta cells working, and of course, motivation and informed patient access to support health care teams. It is crucial. So the very low carb rapid weight loss approach, this is the approach for direct study. With they used an 800 kilocalorie day using meal replacement shakes for 8 to 12 weeks, used in direct trial. The first phase, intensive, very low calorie intake, food reintroduction, and maintenance. We have also the low carbohydrate or keto diet, and keto diet have shown a very, very interesting positive effect in depression and in mental health. So we can use this in some types of our patients with type 2 diabetes. The whole food-based diet, which is the ACLM policy, the American College of Lifestyle Medicine, they focus on dense nutrient food, whole foods, and this will, of course, sharpen the insulin, the insulin sensitivity, and also negative the effect of inflammation. Also, we have the intermittent fasting with different approach in intermittent fasting, and we can use that as leverage because we are living in the Muslim community, and we could use that to reverse type 2 diabetes. So physical activity, it is crucial. We have a rule of thumb, 150 minutes per week, which means 30 minutes a day, 5 days a week, with 2 to 3 seances of resistance. We need to build muscle. So this is a very crucial pillar to diabetes remission. And of course, and my colleagues emphasized very well, if we do not really work on sleep and stress, we cannot get to the result of diabetes remission. So we need to focus on sleep and stress. With mindfulness, there is a lot of strategy we can apply to overcome this. Sleep and stress, okay? The power of community, yes, this is overlooked, yes, but the studies shows that the community and the positive power of community can help a lot. Why? Because there is motivation, there is lesson learned, there is information shared, and there is a lot of things that can tell to our patient that you are not alone. We are together in this. Implementing remission in healthcare. So we need to screen early. Our colleagues talked about 90-90-90. We need to emphasize that very well. Educate patient on remission possibility. We need to discuss that with our patient. We need to set goals, smart goals with them. We need to implement intensive programs with multidisciplinary support with physicians, nurses, dietitians, health coaches. Digital tools can help. We are building our population health management platform. We can help in that, and also follow-up plans to prevent relapse, which can cure. Overcoming barriers. So there is a lot of strategy to overcome these barriers. For example, resistant to change, we can structure a program, dietary support. For motivation, we can clear education or remission possibility. For the medical complicity, we can use multidisciplinary teams approach, and so on. So there is solution to any and each problem. For health care providers, we need to adopt remission as a goal in our plan. We need to enter this in our head. We can cure, or we can put type 2 diabetes into remission. So we are the first target to this. We educate ourselves. We can spend a year to educate ourselves about diabetes remission. And believe me, your whole practice will change. To build team with dietitian educators, coaches, we monitor and celebrate patient victories and advocate for system change and resources with the help of our leadership, of course. The economic case, we can talk about it, but it's obvious. It's obvious that if you are working in population health management and value-based healthcare, this is the best way to go. Type 2 diabetes remission. A vision for Hail, yes, let's imagine that. Hail becoming a beacon of hope, where diabetes remission is not an exception, but an expected outcome of healthcare. Imagine that for a second. Imagine that. So our call to action, first to our beloved clinician, please champion lifestyle medicine. Please learn, please detect early, please screen, please see if any of your patients are adequate for diabetes remission programs. For our leaders, please invest in remission programs and let us work in this path. For our patient, you need to know that remission is possible and seek. We need to know that this narrative should change. And for all of us, we need to build a movement here from حائل Health Cluster for change and for hope. So this is my last words. Together, we can change the narrative from inevitable decline to possible recovery. Type 2 diabetes remission is real, it is achievable, and it is now. Thank you so much.
Thank you, Dr. Abdurrahman, for this information. Now, if there is any question for Dr. Abdurrahman from audience. Any question? Our question, Dr. Abdurrahman. This is a good information and huge number of information. My question, how can reach this information for the public?
This is a great question, actually. You need to know that here and in the world, there are a lot of studies talking about diabetes remission, type 2 diabetes remission. And the ACLM recently really has come up with a huge amount of resources. You can use it, it's free, and we can apply it, we can share our outcome. So now it's the time to act. I will say it another time. The American College of Lifestyle Medicine has a huge resource in their site, and we can have it, it's free, and we can use it right away.
Yes. And you know, there is a question.
Yes. Assalamu alaikum. Thank you, Doctor, for the very nice presentation. I would like to ask you that can you please identify some of the barriers related to sustaining those behavioral changes after the remission? So how we can support our clients and the patients that after the remission, how they can sustain those behavioral changes? Thank you.
That's a great question. Thank you for this question. I think that it's a community effort, not only a physician or the healthcare sector effort. So we need a community to help our people to be stable in remission. For example, the family. If all the family is eating healthy, if all the family is exercising, we can sustain these changes. Of course, we have our physicians and our nurses, our health coaches that can help if there is any relapse. But I think that it is a collective effort to sustain these changes. Thank you.
Any question? Thank you, Dr. Abdurrahman.
Thank you for having me.
This.
Thank you.
Now,
It's our pleasure to honor our moderator and speaker for session 7. Thank you all for being with us throughout day 2. We invite you to carry this insight forward and come back tomorrow ready for another inspiring day, learning, growth, and connection. We look forward to see you again.